Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we are going to discuss common skin related medical conditions which are asked in medical coding interview. So I've decided to come up with medical coding interview preparation series just like how I did CPC exam preparation series. So today I have taken a skin organ system, that is integumentary organ system, and in future I'll be taking the other organ system and related medical conditions, and I'll be discussing them. Okay, so as I said, in today's video or in today's session, I have taken all the skin related common medical conditions and their ICD code range. Also, if any specific coding guidelines are there, we will discuss that. And if you are completely new to medical coding, and if you are willing to learn medical coding, you can consider my basic to advanced medical coding course. And if you have already completed your CPC training and want final exam preparation, then you can join my CPC exam preparation live classes. And also, if you are unable to attend live classes, then you can reach me out for recorded classes. Okay, so complete CPC recorded classes will be available, and you can get it. Okay, so let's continue, or let's start our session. So first question, or the first medical condition is, what is skin cancer? So skin cancer is an uncontrolled growth of abnormal skin cells, most commonly due to prolonged exposure to UV radiation from the sun or tanning beds, and it is most common form of the cancer in the world. So as we know, skin cancer is the most common cancer in the world, and it commonly comes due to prolonged exposure of UV radiation or tanning beds. And there are three major types under skin cancer. The first one is basal cell carcinoma, which is also called as BCC. And the second one is squamous cell carcinoma, which is simply called as SCC. And lastly, melanoma. All these three type of skin cancer is very important. And in our ICD classification, we do have separate type of cancer ICD codes. Okay, we need to identify what kind of skin cancer that patient is suffering from. Is it BCC or SCC or melanoma? And according to that, we need to check the site, laterality, okay, and then we need to assign the appropriate ICD code. So now let's understand the characteristics of basal cell carcinoma. So as you can see, basal cell carcinoma is most common type. Okay, it's a common BCC skin cancer is the common type, and it grows very slowly. Okay, it grows slowly and it rarely spreads. Okay, so it will not immediately, it will not spread or it will not get metastasized. For secondary site, it will not spread. Okay, it grows very slowly and appears as a pearly or waxy bump, often on sun exposed area. So you can see the image here. So this is how basal cell carcinoma will look like on the skin. And next one is squamous cell carcinoma, that is SCC. So this is second most common, and it can spread if it is not treated. So if patient is having a SCC, then immediate medical intervention is needed. If the patient is not taking treatment on time, then there is a high chance that squamous cell carcinoma can spread and can get metastasized. Okay, and it may appear as scaly red patches or open sore. Lastly, melanoma. So melanoma is the least common skin cancer, but it is most aggressive and deadly. So it can spread easily and it grows very fast. And it arises from melanocytes, that is pigment producing cells, and it can appear as a new mole or change in existing mole. So melanoma can grow, and there is a ABCDE rule. Okay, so there will be a changes in symmetry, border, color, okay, and diameter and the lesion elevation. or that lesion, how the lesion is evolving. Okay, everything we need to consider under melanoma skin cancer. And if you see our ICD code classification for C43 to C44 series, we have all the skin types, skin cancer types, that is BCC and SCC and melanoma. All types of skin cancer related conditions are listed from C43 to C44, that is neoplasm table you can see. And if it is in situ or uncertain behavior, then we will be coding from D series. Okay, and you can see the example. So basal cell carcinoma of skin of lip, so C4401. Squamous cell carcinoma of skin of lip, C4402. And melanoma, C43, okay, C43 series. So we have all the variations. It includes type of cancer and anatomical site, and again laterality, and also the behavior. Okay, primary malignancy or secondary malignancy, in situ, secondary, metastatic. Okay, likewise in the neoplasm table we will able to see. But anyway, for skin cancer it is direct: basal cell carcinoma, squamous cell, melanoma, or unspecified. Okay, so all of these characteristics you should know. So the interviewer may ask, explain skin cancer. Okay, at least you should be able to tell what is skin cancer and what are the types. And if you know the code range, ICD code range, you can also tell that. Okay, so for this skin cancer related, you can check neoplasm coding guideline as it is cancer. So next we have pressure ulcer versus non-pressure ulcer. Okay, pressure ulcer versus non-pressure ulcer. What is pressure ulcer? So pressure ulcer, also called as decubitus ulcer. Pressure ulcers are localized injuries to the skin or underlying tissues, typically over bony prominences like the sacrum, heels, hips, and elbows, caused by prolonged pressure or friction. And pressured ulcer is common in bedridden or immobile patients. Okay, it is mostly very common in bedridden patient because they'll be on bed, so there will be no movement. Okay, due to the pressure and friction, they will develop this pressure ulcer. Okay, mainly on their back area or hip. Okay, all of these specific sites they can develop pressure ulcer. And for pressure ulcer and non-pressure ulcer, we do have ICD coding guidelines. Okay, from the ICD chapter 12. Okay, and then what is non-pressure ulcer? So non-pressure ulcer is also considered as chronic ulcer, and it results from conditions other than pressure. Okay, here there will be no pressure, but it is due to other medical conditions. Okay, example include peripheral arterial disease, venous insufficiency, diabetes mellitus, trauma, or infection. Okay, because of these other medical condition, patient may develop non-pressure chronic ulcers. Okay, so if you see the ICD code classification for pressure ulcer, we have the codes from L89 series, and here we need to check the site, laterality, and stage. Okay, like pressure ulcer stage 1, stage 2, stage 3, unspecified stage, or unstageable stage. Okay, unstageable means when this pressure ulcer is covered completely with the sloth. Okay, where provider is couldn't determine the stage of the pressure ulcer, then we need to consider it as a undetermined. Okay, undetermined stage or unstageable. Okay, unstageable pressure ulcer. Okay, we cannot consider it as unspecified. Instead, we should consider it as unstageable. Okay, so that is for pressure ulcer. And for non-pressure ulcer, here we have the severity: mild, moderate, okay, high. Likewise, we need to check the severity and we need to assign the codes. And the code starts from L97 series. So L89 is for pressure ulcer, L97 is for non-pressure chronic ulcer. And you can see here from the chapter 12, that is disease of skin and subcutaneous tissue. From this chapter, we do have coding guidelines for pressure ulcer and non-pressure ulcer. Okay, so guidelines are very important, and all the guidelines regarding pressure ulcer and non-pressure ulcer you need to check before going for interview. Okay, anything they can question. Say for example, what if you get a documentation as healed pressure ulcer? How you will code? So if it is mentioned as healed pressure ulcer, then you don't need to code for that. Okay. Likewise, they can also ask a difference between unstageable pressure ulcer and unspecified pressure ulcer. Okay, so I'll just show the difference. So just see L89, L89, sorry, L89.0. Okay, so see L89.0 is pressure ulcer, unspecified elbow, unstageable. Okay, just see the variations here. I have taken only the category code. So to make you understand, I will just take the, so pressure ulcer, unspecified elbow, stage 1. So it's not visible in that. Okay, just we need to check the series 0 end with unstageable and the series code 9 end with unspecified stage. Okay, so there is so many coding guidelines. So if I explain chapter 12 specifically, I can discuss all the ICD coding guidelines which regards to pressure ulcer and non-pressure ulcer. So just remember the ICD code categories L89 and L97. Later you can just refer. Just put that code and check all the laterality and the variations in the ICD code. So next common condition is contact dermatitis. So contact dermatitis means it's a skin inflammation triggered by direct contact with an allergen or irritant, and it present with redness, itching, swelling, and sometimes blistering. So the common cause include soap, detergents, and plants. It include poison ivy or latex. Okay, and there are two types here. One is allergic contact dermatitis, which is immune reaction, like it is a allergic reaction. And one is irritant contact dermatitis. It is due to any kind of chemical exposure or burn. Okay, it is non-immune reaction. And coming to ICD-10 code set, so from L23 series to L25 series, if you check, we will have all the variations under dermatitis, contact dermatitis. Okay, we need to check the type of the dermatitis, and accordingly we need to select our ICD code. So next one is psoriasis. Psoriasis is a chronic autoimmune skin disease that speed up the life cycle of the skin cells, resulting in thick red scaly patches, and it is non-contagious condition that often has a generic predisposition and may be triggered by stress or infection. Okay, so psoriasis is also very common skin related medical condition, and as they said, it's a chronic autoimmune skin disease. So here under psoriasis we do have type that is the most common and widely used is plaque psoriasis. Okay, plaque psoriasis, and other types include erythrodermic types. And coming to symptoms, psoriasis will have red patches with silvery scales, itching, and joint pain. So patient who suffer from psoriasis with joint pain, we do have this code psoriatic arthritis. Okay, psoriatic arthritis. And coming to ICD code classification from the category L40 series, we have all the types of psoriasis. By reading the complete documentation, identify the type or the specification of the psoriasis, and accordingly you can select the ICD code. So next one is cellulitis. Cellulitis is a bacterial skin infection involving dermis, subcutaneous tissue, usually caused by Staphylococcus or Streptococcus, and it typically present with redness, swelling, warmth, and pain in the affected area, often accompanied by fever. Okay, a patient who have cellulitis, the symptom as a symptom they'll suffer from fever also. Okay, and in the cellulitis it is most common in extremities, so like lower limb. In lower limb, cellulitis may often come, and the ICD-10 code criteria or category from L03. Okay, we need to check the laterality and the specific anatomical site like lower limb, upper limb, and we need to assign the accurate ICD code. So next one is Acne Vulgaris. So it's a common skin disorder primarily affecting adolescents but also adults, caused by clogged hair follicles due to excess of oil and dead skin cells. And it leads to pimple, blackheads, cyst, and scarring. So all of these acne conditions, when patient is suffering from acne, in integumentary, if you take the CPT chapter, we do have acne removal procedure. Okay, so for that we can assign the CPT code, and for if patient is diagnosed as acne vulgaris, we can assign the ICD for medical condition. Okay, so integumentary system I'm talking about. So next coming to ICD, so L70.0, under L70 if you check, okay, L70. So we have all the acne related different types of acne. ICD codes are there. So you can check the specification and you can code it. So for acne vulgaris, the code is L70.0. So next skin related medical condition is seborrheic keratosis. Seborrheic keratosis is a benign, okay, as you know, benign means it's a non-cancerous skin growth that develops with age, and it appears as a brown or black or light tan waxy, scaly or slightly elevated lesion. Okay, when we are talking about seborrheic keratosis, we need to check whether it is inflamed or non-inflamed. Okay, so if it is inflamed seborrheic keratosis, then you will code L82.0, and if it is non-inflamed or there is no specification, you can consider it as L82.9. Okay, so for L82.1, for non-inflamed, you can code other seborrheic keratosis. Okay, just check from the category L82. And next we have actinic keratosis, that is also called as solar keratosis. So actinic keratosis is a percutaneous skin lesion. Oh, sorry. Actinic keratosis is a precancerous skin lesion caused by chronic sun exposure, and it is considered as a risk factor for squamous cell carcinoma and often appears as a rough scaly patches on sun exposed areas. Okay, so actinic keratosis and seborrheic keratosis, like we code more, okay, common conditions with the patient. So for this actinic keratosis, ICD code is L57.0. L57 code set, you can just check actinic keratosis. And next one is hyperpigmentation. So hyperpigmentation refers to darkened patches or spot on the skin caused by excess of melanin production, and it can occur anywhere on the body, and it is usually harmless but often cosmetically concerning for the patient. Okay, so hyperpigment, like we will have the types of hyperpigmentation. Okay, like post-inflammatory, or due to general hyperpigmentation, or drug-induced hyperpigmentation. Okay, all of this will be there. Or solar, I mean, lentigo, we say, right? Lentigo, that also like an alternative word. And ICD codes, L81 series. Okay, this particular code set you can check for hyperpigmentation related skin medical condition. Next, we have hives. So hives is a sudden onset allergic skin reaction